In this video, we will briefly discuss about worm infestation in children. Worm infestation is a major public health problem in India as well as in some developing countries worldwide. It is more commonly seen in children more than 1 year of age. It is not that much common in infants. And coming to the common worm infestations that are seen in children, they are nematodes, which includes roundworm, pinworm also known as threadworm, and hookworms. And cystodes include tapeworms. And coming to the common clinical manifestations that are seen in worm infestation, mainly abdominal symptoms are seen, like pain abdomen, nausea and vomiting, diarrhea and abdominal distension can be seen. And pica, that means ingestion of non-nutritious substances like chalk piece, eraser, slate pencils, soil, wall paint, etc. It can be seen in worm infestation. Actually, pica is also one of the causes for worm infestation. And worm infestation can cause irritability, sleeplessness in a child. And it is also responsible for the reduced physical and cognitive development in a child. And coming to the roundworm infestation. Roundworm genetic name is Ascaris lumbricoides. It lives in the lumen of jejunum and ileum. It can live up to 2 years in the gut. It is the largest nematode. It is transmitted through fecal-oral route via contaminated food, water and soil and hands and fingers. And specific manifestations of roundworm infestation include Ascaris pneumonia. It will manifest as productive cough, fever and bronchopneumonia. It is also known as Loeffler's syndrome. It can also cause chronic bronchitis, which manifests as chronic cough, and urticaria, fever, protein energy malnutrition and anemia, both including microcytic and megaloblastic, can occur. And complications like intestinal obstruction, intestinal perforation causing peritonitis, pancreatitis and hepatitis and liver abscess can occur, which can manifest as jaundice and liver failure, which is called as Ascaria encephalopathy. As we discussed that it is the largest nematode, it can cause intestinal obstruction and intestinal perforation. Coming to the pinworm or threadworms. The genetic name of pinworm is Enterobius vermicularis. It lives in the cecum, appendix and proximal ascending colon. It can live up to 20 days. It is more common in young children. And the route of transmission of pinworm is fecal-oral route. That means via contaminated food, water, soil, hands and fingers. And auto-infection can also occur. What is auto-infection in pinworms? The worms come out from the anus during the night time and lays eggs on the perianal skin. It causes itching sensation for the child. The child scratches the perianal area and the eggs get deposited under the nails. When the child puts the fingers into the mouth, the eggs present under the nails are ingested into the stomach and auto-infection occurs. And specific manifestations of pinworm infestation include perianal itching, perianal skin excoriation, teeth grinding, nocturnal enuresis and sleep disturbances can occur. And complications like appendicitis and recurrent urinary tract infections can also occur. And coming to the hookworm infestation, the main worms that are responsible for human infestation are Ankylostoma duodenale and Nectar americans. It attaches to the villi of jejunum and can live up to 4 years. The main route of transmission of hookworm to the humans is through skin penetration in barefooted children. That means in children who are walking in the outfields without wearing chappals or shoes, these hookworms penetrate the skin of those children. And specific manifestations and complications of hookworm include black stools, perverted taste, constipation, anemia, both microcytic and megaloblastic, and ground itch, that means the itch at the area where the hookworm enters the human body. And bronchitis, bronchopneumonia and Loeffler syndrome can also occur as we discussed in roundworm. And tapeworm. The main tapeworms that are responsible for human infestation are Taenia solium and Taenia saginata. The main route of transmission of tapeworms to the humans is through eating of improperly cooked beef and pork. Autoinfection can also occur through retroperistalsis. And the diseases caused by tapeworm infestation are teniasis, that is intestinal infestation of tapeworms, and neurocysticercosis, that is cerebral infestation of tapeworms, and other visceral cysticercosis can also occur. And coming to the diagnosis of worm infestation. The main tools for the diagnosis of worm infestation are history and physical examination. In history, we can get passage of worms in the stools and also perianal itching in case of pinworms and chronic cough in case of roundworms and hookworms, and history of beef and pork intake in case of tapeworms, and history of pica also we can get. And stool examination is done to know the species, but it is not done routinely.